Hello everybody, Dr. Bill Sterett here again, following up on the women's ACL. We've talked about some of the anatomical reasons why women tear their ACL more frequently than men in certain sports. We've talked about some of the physiologic or athletic reasons why they might be more prone to tearing it. So now let's talk about how that affects me, or in my world, in the surgeon's realm. So if a woman comes in who's hyperlax or really hyperextends that knee quite a bit, and they've torn their ACL, maybe using a hamstring graft might be a little higher risk. Unfortunately, a lot of our ski racers and jumpers don't like some of the other grafts, like a patellar tendon graft, because of the risk of tendonitis. So we have to get creative and actually think about different ways to reconstruct or to treat them surgically or through rehabilitation. So sometimes we might recommend a quadriceps tendon graft for their ACL. I know this is a lot of information, but just understand that there are going to be differences about why we might not have the exact same treatment recommendation for a woman versus a man. So that's about all I need to go into about that at this point. Rehabilitation is another issue. So somebody who is really hyperlax or hyperextends their knee quite a bit, we're going to have to protect them from that in their rehabilitation. We might have to introduce jumping and landing or plyometrics a little bit later in their rehabilitation than we might in their guy, or at least do some training before we get into jumping and landing and not put their ACL at risk. So there's all sorts of things that we need to think about, differences in men and women, as we all know, but also from a surgeon standpoint or rehabilitation standpoint, we have to take those things into account. I hope that helps you understand why some people might get one surgery, some people might get another surgery with the exact same injury. I'm Dr. Bill Sterett with your Sports Medicine Minute. Thanks for listening.